Good evening, everyone. It gives me immense pleasure to welcome you all to this evening session of the first fever quiz competition of 2024. And here we are working with Eastern Zone postgraduate student who will be participating today. Before we go into the quiz, I would like to tell very briefly about Fever Foundation. Fever Foundation is an independent, non-commercial foundation supporting the educational and academic activity to address the unmet needs in fever management. The foundation is committed to conceive, build, and sustain program and make scientific initiative which are aimed at providing evidence-based update to healthcare professionals. So, if you look at the vision of Fever Foundation, the vision is to strive towards imparting knowledge and unmet needs and provide information on research, education, and therapy updates on fever management. So, what are the activities of Fever Foundation? We conduct annual fever conference, already sixth annual over. This year, 2024, we are having the seventh annual fever conference. And fever CMEs are conducted across India throughout the year to give update on the fever and its management and difficult cases to see, etc., both for physician, pediatrician, and family physician. We bring about book on fever management every year, two books on fever management, one for pediatrician, one for physician. We bring in clinical epidemiological research happens under this Fever Foundation. Challenging case presentation competition, Young Scholar Award, uh, patient education, paramedical education, parent education, public awareness activity is also done. This year, we did a special activity called Fever Week. It was between 24th to 30th May. First time in India and first time in the world, this Fever Week was conducted. This was to commemorate the birth anniversary of Sir Gabriel Fahrenheit, who invented thermometer and Fahrenheit scale. And in the entire week, we had national panel webinars, which is a mega webinars on 24th May for pediatrician, 25th May for physician, and we conducted nearly 100 CME programs across India in that fever week. And there were parent, patient, public awareness activity through FM radio. Our eminent advisory board members helped us in conducting these in all the regional languages as well. And through fever research activity, we have initiated this year first original research activity. It is started at Ellen Medical College, Bhopal. And fever quiz is a regular activity. This year quiz is on 23, 24, 25, 26 July, and the pediatrician's quiz is at 4 o'clock, and internal medicine quiz is at 7 p.m. every day. And for all the postgraduate, I would like to inform you that poster competition is also on. The last date of poster submission is 10th, and poster presentation happens on 17th or 18th of October. A fever training manual has been developed. This will be a certificate course for general practitioner or family physicians. And also, I take this opportunity to welcome you all to FEFCON 2024, which is the seventh annual National Conference of Fever Foundation, and it will be 23 and 24th of November. The link will be sending to you. It's a free registration. Kindly register. This will be a forum where several specialty physician, infectious disease, intensivist, critical care specialist, pharmacology, microbiology, pathology, epidemiology, all come under one roof to discuss about various aspects and the challenges on fever management. So please do participate in this conference. Today, we are in the first quiz, and our quiz master for today is Dr. Gansham Pangte, sir. Sir is a professor of medicine at Lady Harding Medical College. He's a rheumatology and medical ICU in charge at LHMC. Joint Secretary, Indian College of Physician and API Delhi chapter. He's executive member of Delhi Rheumatology Association, associate director of API Textbook of Medicine. He's published more than 100 publications in reputed journals, co-edited books such as Pearls for Scientific Paper Writing, Research Methodology, Ethics in Clinical Research. And he's a medicine MD and NB postgraduate teacher and examiner for Delhi and AIMS Rajasthan. Sir, Dr. Gansham Pangte, sir, it's a pleasure and privilege to have you as quiz master. Welcome, sir. We have today's quiz host is Dr. Anupam Prakash sir. Sir is MD General Medicine plus PGCC Hospital Medicine and PDCDM. He's a director and professor of medicine and head of Department of Accident and Emergency at Lady Hardinge Medical College Associated Hospital, New Delhi, editor-in-chief of Indian Journal of Medical Specialties, associate editor of API Textbook of Medicine, member of governing body of API, president board of management of Delhi Diabetic Forum, President of Indian Society of Atherosclerosis Research, Vice Chairman APA Delhi State Chapter, Member of Advisory Board, JAPI, JIACM, and Journal of Case Report, and he is also and very founder member of Fever Foundation. So, Dr. Anupam Prakash, welcome to you, sir. Thank you very
Thank
much.
you.
We have three subject expert with us to help you in conducting this. Dr. Jayant Kumar Panda, sir. Sir is the professor at the Department of Medicine at SCB Medical College Hospital. He has several credentials. He has more than 100 publications, very eminent teacher and clinician. So it's a pleasure to have him as expert. Welcome to Dr. Panda, sir. And we have Dr. Ramesh Raghaval, sir, another subject expert, professor of medicine at the Lady Hardinge Medical College and Associates Hospital. He has been helping us in conducting this quiz program, and he also has several more than 100 publications to his credit. And sir is always there for any scientific meet. Dr. Ramesh Agarwal, sir, welcome to
Thank
this.
you. Good evening. Thank you.
Good evening. Dr. Subhalakshmi, madam, always smiling, and she's also there with us for helping us in quick quiz from the time FEFCON first started. And madam is also professor at Department of Medicine, Lady Hardinge Medical College, and also she takes care of thalassemia unit as well. Madam, it's a pleasure and privilege to have you with us as subject. So welcome to you, ma'am.
Thank you. Thank you.
And to conduct this meeting, and we have a, special jury with us to ensure that the rules and regulation, everything followed. We have Dr. M.K. Sudarshan sir as our jury. That is ex-chairman of Karnataka State COVID-19 Technical Advisory Committee, Government of India Advisory. He's also founder member of Fever Foundation as an advisory board member. He's ex-director, retired dean of principal and professor of HPD of Community Medicine at Kempegowda Institute of Medical Sciences, Bangalore. He is member of WHO expert consultation on rabies at Geneva. He NABH assessor.
You can cut short, madam. Thank you. It's
Yeah,
okay. Thank you. Yeah,
he also has
we'll carry on.
more
Carry
than
on. Carry on.
publications.
Thank
Thank
you.
you
Thank
very
you.
much, sir. It's a pleasure and privilege to
Yeah.
have you with us, sir. Thank you very much. Before I just hand it over to our quiz host, I just run through the quiz for all the students and participants taking part in this. Um, Please note this quiz is for postgraduate students only. The quiz consists of a multiple choice question. So there is 15 seconds to answer each question. The option to be selected by clicking on the bottom of the text panel. You would see the video display with option, but that is only for representation purpose. You need to select the option which is below the video, those text panel where you need to select the option and submit it. The participants are advised not to leave the platform. Once the answer is submitted, it will not be possible to revert. So no negative marking. The winner will be the maximum fast right answer. In the event of tie, the tiebreaker round will be done to decide the winner. And it is advisable to use the laptop or desktop because there are images, etc. in the questions. And you should not use mobile phone for getting answers from any colleague sitting nearby. And Fever Foundation is not responsible for any form of technical error, for example, poor net connectivity. Participation in the quiz implies that the participant accept the integrity of these rules. The participants who have given incomplete or inaccurate personal or contact details will be disqualified. Non-compliance with the rules of the results in the automatic cancellation of the participants in the quiz and of the candidature for the prize. First and second winner from each zone will be entitled to enter the national level quiz at FEFCON 24, which will be scheduled in November 2024. And finally, quiz master and judge's decision will be final. With this, I hand it over to our quiz host, Dr. Anupam Prakash. Thank you very much. I wish you all the best for the quiz. Thank you.
Well, thank you, Dr. Manjula. It is a pleasure to be here, and I must compliment the Fever Foundation for conducting this quiz year after year. And not only the Fever Foundation, but Dr. Sudarshan has been the backbone. He has always been there since its inception for the quiz program. And obviously, the team you see, Dr. Ghanshyam Pangti, Dr. Shubhlakshmi, Dr. Ramesh Agarwal, they are the people who have been conducting the quiz for physicians for quite a significant number of years. But each time it goes with new questions, new format, and there are new winners. And it is a pleasure to have the postgraduates participate in this quiz, because you are the future of the nation, and the future healthcare depends upon you. And irrespective of who wins it, it is important the participation part. So once you are participating, it provides you a platform for the future. And it, because it is not only correct answers as is the format for most of the things, it is the fastest correct answer that you project. So that again indicate your, that is, somebody told me some people are attending emergencies. So it is important that you learn to handle the emergencies and decision making, very important. So early decision making, that comes handy not only for these questions, but this prepares you for emergency management. Even in life also, you have to take decisions at times in a very short period of time, and within the nick of a second, at times things can go haywire also. So all the best, Dr. Manjula has already said. But before we hand over the mic to our opening batsman, Dr. Ghanshyam Pangti, I will request Dr. Sudarshan, because he is the most senior person here and he has a wide experience. He is a national, internationally renowned figure and a very important person for our Fever Foundation also. And we value his presence always. Dr. Sudarshan, sir, please.
Thank you, Anupam Prakashji. And as we are already late, I will not go into the details. I wish all the participants all the very best, and they carry good memories of this quiz program. You will learn from a good experience of your participation here. And with this short few words, it is over to the quiz master to start the quiz competition. Thank you very much. Thank you.
Thank you, sir. Thanks to the Fever Foundation for giving us the opportunity for conducting this quiz. And congratulations to the Fever Foundation also for conducting. This is the 7th conference and quiz edition, which is being conducted by Micro Foundation of Fever Foundation. And I'm thankful to Dr. Anupam, Dr. Subbalakshmi, Dr. Ramesh, Dr. Sudarshan for being part of this and will be helping me in conducting this quiz. And best of luck to all the participants. And it will be a 20-question quiz. And if there's a tiebreaker, we can have 3 more questions. And you should remember that Dr. Anupam has already said you should have a correct answer, and the earliest one who gives the correct answer will be the winner for that question. And number of correct answer at the fastest finger first will be the winner of this quiz. And the winner will go to the national conference, which will be conducted in November, most likely in Bangalore, and you will be invited there. So without wasting any time, we will start the quiz. But first, we will start with a dummy question, so that you should be ready with that. And also, we will request you all to use your desktop or a laptop only, because on phone, you may not see that 4 option which you have to give. All question will be having 4 option, and you have to correct one of them, one A, B, C, D. And one of them will be the correct answer, only one. There may be some slight similarity between some option, but best answer to be given. So Computer G will be the helping person here. And I will ask Computer G to start first dummy question. This is just dummy question. Can we start, Computer G? We have 15 seconds to answer this dummy question. So I will read the first question. Okay, question number 1 is the green planet in the solar system is, A option is Mars, B is Uranus, C is Venus, and D is Earth. So green planet. Your time starts now. You have 15 seconds to answer either of the 4 options. Okay, so time is over. So I hope all of you have already answered, and I'm pretty sure that most of you have the correct answer. So Computer G must be compiling the answer. So I feel it's Uranus is the answer, and we can have the number of percentage of people who have correctly answered that we can see by Computer G, as well as we can see who is the fastest finger first for question number 1. It's a dummy question. There's no marks for this question. So Uranus, although I was thinking Earth is the correct answer. Okay, let's see. It's a difficult. Computer G has come with a Uranus answer. It's the greenest planet. Okay. Let's see who is the correct fastest finger first, Computer G. It's a surprise for me also. I have to read some astrology now.
I know only Mars as red planet.
Yeah, that's why it's a difficult one. Computer G, can we have the answer?
No,
I
it
hope
will take
students
it
have-
will take some time. It will take some time.
Okay, okay, okay. Take some
It's a
time.
Earth is
difficult
obviously
question.
the green planet because it has a lot of greenery.
No, sir, it
Yeah.
has a lot of methane, which in
Lot of
sun
people
it
have
looks like green.
86%. So maybe Computer G want to say Earth is a blue planet, not a green.
Ah, correct.
Uranus is the green planet, but I don't think it's green due to greenery or plants.
That is methane gas, sir, basically.
Methane gas. Okay, so Manjula ji is the expert here.
No, no, sir.
And,
Google.
Okay, okay. So Computer ji, can we have the winner of the first
Yeah.
camo question? And it's Yagna Raman V has given the correct answer. See, the person has given answer in
From
within-
Assam.
and he's from Assam. Yagna Raman. Okay, Assam. Dibrugarh. Very good. So this is dummy question, no marks for it. Just to see that your laptop is working and you are able to correctly answer this, and your internet is also very fast. 4 seconds is good time. So we'll come to the second dummy question again. The study of heavenly bodies is known as A is astrophysics, B is astronomy, C is astrology, or D is astronautics. So your time starts now. Okay, so Computer Ji has already stopped his watch, and we have 4 options. And again, I said that the heavenly bodies and this astronomy is slightly tricky for me, and I feel all of you postgraduates also. So let's see who has the correct. What is the correct answer? Astrophysics or astronomy? So it's astronomy is the correct answer, and I'm not very good with that. I don't know, Dr. Manjula, maybe the. Astronomy is the study of heavenly bodies. Really,
Dr. Ghanshyam, you must be good with astrology. So you can predict what is
Who
the
is
correct percentage.
Right, sir. But I hope all the people are knowing that they have to click on the text back, which is below the visuals. I hope all of you are getting it correct. The visual, what you see, if you press on that, it won't be collected as an answer. There is a text box below that. I hope you are all clicking on that.
Yeah, so Dr. Ghanshyam, I think your network has some issue.
Yeah,
So if you can join,
correct, sir.
yeah. So I think he will be rejoining, ma'am.
Yes, sir. You can continue, sir. Third.
Yes. So the correct answer is, ma'am, as we all know, it is 50% of the people still know what was the correct answer. I really didn't know about this. So this is a very tough question. Dr. Anupam, any views about this particular question? Your expert comments are needed for this.
Yeah, see, this was actually complicated by using a number of things related to astro. So astronomy, astrophysics, astrology. So that
Yeah.
was the problem. So everything was astro. And
Yeah.
luckily there was no astronaut out there. So Shah will now take us back.
Yeah, so Dr. Ghanshyam has joined.
Yeah. Again, yeah, I would like to ask
Sir,
from
you are
the RX
muted.
event.
Dr. Ghanshyam, you are muted.
RX event, are you seeing everyone is participating? They're able to check?
Yes.
Yeah? Okay, good.
Everyone has answered, Computer Ji,
Have everybody attempted
sir.
answering? Okay.
and you are noticing the answer. Okay. So there was some internet issue. I hope it doesn't happen. I have taken up one more computer here. Okay.
Madam,
So-
how many are there? How many are there?
I think at more than 20, 25, I think
Okay,
so.
thank you. Thank you.
Okay, so this is the third dummy question, no marks for it. Summer Olympics 2024 is hosted by which country? Is it China, India, France, Germany? Computer G, we can start the time.
Okay. Can we have the right answer? I think Gansham sir is having again an internet issue. Sir? Gansham sir? Okay.
Yeah, Dr. Ghanshyam
Yeah,
again has some
I think
network
I'll
issue.
yeah,
So I think many people must be aware of this, that France is hosting the next Olympics, and I am sure when the computer G is going to show us the result, it should be more than 70% of them will be right. So computer G, when we are ready with the result, please display it. China, India, and Germany. So these are the three competitors which
I
I
know for
really,
sure that India was not hosting. Remaining, I was not aware.
yeah. So very, very poor general knowledge, sir. We are just restricted to our field, and generally we do not know much about what's happening around.
Dr. Ghanshyam is back. He will take us to France.
Not bad, sir. Hmm.
But there are some who thought in India, I am better
I
than
know.
some.
I know.
Probably they are hoping, sir, something will happen in India.
I think they were trying to see the wrong
Whether
answer.
all
Dr.
the
Ghanshyam, you
options.
have to take over.
Mhm. No, sir, it's again repeatedly
Acha,
saying
it is some issue.
Dr. Ramesh Agarwal, can you just continue till
Yeah,
sir
yeah,
comes in?
yeah, yes, ma'am. So 62% have correctly answered. France and India, as sir said, 25% of them. So I think we are done with this, and
Yeah.
so we can come. And again, Jagannaraman V. So he is winning, and he has won all the three dummy questions. Congratulations. And just wait, computer ji, please do not display main questions right now. Let Dr. Ghanshyam join in with his appropriate network. Then only we will start. We can just wait for a second or a minute. I think that's okay, Dr. Anupam, sir.
Yes, yes. I think we can wait for a couple of
We can just
seconds.
wait.
Okay.
And
We will be starting
I
from.
think Ghanshyam, we can request Dr. Ghanshyam to join through his mobile also, because he will not have any problem. He doesn't have to answer the questions. Mobile network may be better.
Yeah, but the participant, I hope you are all became
Any queries
connected.
from the participants, they can address. Yes, Dr.
Yeah.
Manjula is right.
Okay, so, and because we are going for now main round, there'll be 20 questions, so be fast to get it right. Sir has not joined in.
Sir is joining with phone now. He will be joining.
Okay. So,
Hello. I'm audible
yes,
now.
Now you are audible, sir.
I think there was some internet problem. I have joined from my phone internet now. I
Okay.
hope this will continue. Sorry. So I think the last question, demi question was France, which was the
Yes.
correct answer. And I hope my colleagues have already helped me. So we'll start the quiz without wasting any time. Computer Ji, can we have the first question? So this question will be having marking also. So we'll start with question number 1. Which of the following mechanism is primarily responsible for the elevation of core body temperature during a fever? Is it increased metabolic activity in the
Dr. Ramesh, sir, continue.
In the muscles, the second option is activation of the hypothalamic thermoregulatory center by prostaglandin E2. The third is direct action of exogenous paragens on body tissues, and the fourth is vasoconstriction induced by catecholamines. And your time begins now. You need to answer as fast as you can. Zero, 1, 0. So the time is up. The bell has rung. And when we talk of fever, it is important for us to understand that where exactly is the problem. This whole quiz is centered around fever. And we talk of the hypothalamic set point, which is actually increased. So let us go to the computer G, and computer G is Dr. Ghanshyam is back. Dr. Ghanshyam.
The right answer, please. Sir, you're on mute, sir. Ghanshyam, sir. Please unmute, sir. Dr. Ghanshyam, sir, you're on mute, sir. Okay, please go ahead, sir.
Okay, so I'm audible. So answer is B, activation of the hypothalamic thermoregulatory center by prostaglandin E2. So this is the main center for thermoregulation in our body. So because
Okay.
they are not the primary mechanism for increasing the temperature, they are the secondary mechanism. But mainly these all activity like exogenous pyrogens given
Is having today too much of issues. Dr. Anupam, sir. Sir is having very
So
bad.
all these mechanisms are actually correct when we talk of heat production in the body. So they will contribute to heat production. But when we talk of fever, the elevation of the core temperature of the body, then the hypothalamus has to reset and send in signals to raise the temperature. So that is what the answer is, activation of the hypothalamic thermoregulatory center by the prostaglandin E2 mechanism. So that is why actually when you use, I hope there is no question related to that, but yes, anyhow, I will just talk about it. When you use NSAIDs or you use drugs, so, oh, that is wonderful. Everybody has got the answer correct. So I don't need to elaborate any further. I think we should give credit to all the participants because they understand the basic pathophysiology of fever. So we will move to slightly tougher questions now. And can we have the fastest finger first? Who got the answer the fastest? So Himanshu Chauhan from Dayanand Medical College and Hospital, Bihar. So this is Darbhanga Medical College, I think. So anyhow, DMCH from Bihar. Dr. Himanshu Chauhan has got it correct. And very good. Congratulations, Dr. Himanshu. And I think the person from Dibrugarh will have to be fast, not only for dummy questions, but also for the academic questions. So general knowledge is good. You need to have some knowledge, but yes, fastest finger. So this was obviously 100% correct, but fastest was Dr. Himanshu. So congrats, Dr. Himanshu. I think we'll move to the next question. We should continue. So which of the following genetic mutations is associated with familial Mediterranean fever? NLRP3 gene mutation, TNFRSF1A gene mutation, MEFB gene mutation, NOD2 CARD15 gene mutation. So time begins now. Last 3 seconds. Time is up, computer G. The bell has rung. So when we talk of fevers, I told you it is I hope not 100% of the answer is correct this time. We had the 100% correct. So for me, obviously, it is a more difficult question than the earlier one. And actually, when Dr. Sudarshan has learned familiar Mediterranean fever, or even when I was studying, I am much junior to Dr. Sudarshan, but yes, even when I was learning this, we never had these mutations. So we learned about Mediterranean fever, familial Mediterranean fever. But yes, now we have the genetic basis outlined. So it is important to find out. So what is the correct answer, computer ji? MEFB gene mutation. So that is right. Dr. Ghanshyam is back. I think Dr. Ghanshyam will take us forward with this.
Yeah, Dr. Ghanshyam, sir. No, sir. He's there, sir. Is on mute.
Anyway, till Dr. Ghanshyam turns it on. So these are different, these are specific types of fever. When you talk of Mediterranean fever, you talk of the fever. Obviously, you don't find this in our country. It is peculiar to that area. And that is why gene mutations, we usually do not encounter this. So 77% of the people. So the correct answer was computer ji was MEFB. This was the correct answer. So that means Dr. Sudarshan sir and myself are now old timers, and the correct gene answer of 77% are aware. So anyhow, we are moving from 100% to 77%. People have tried other answers also. So congratulations again, everybody. So that means everybody is participating and the show is on. So let us get the fastest finger. Computer ji, please highlight. Dr. Nilanjan Mal from RIMS, Ranchi, Jharkhand. Very good. Congratulations, Dr. Nilanjan. And that makes it very interesting. So we have 2 questions and 2 different winners. So that is heating up the race. Yes, Dr. Sudarshan, sir.
He has taken 1 second. That has to be highlighted.
Very good. That is wonderful. Yes, indeed. Very nice. So can we move to the next question? Dr. Ghanshyam is not there anyhow. We will move to the next question.
Sir is there, but sir is on mute.
So what is the pattern of fever on this fever charting? Is it intermittent fever, remittent fever, continuous fever ending with crisis, or saddleback fever? So your time begins now. So your time is up, and computer ji has rung the bell, and now it is important. This is a very interesting fever chart, and you can see there are variations. And if you remember the definition of continuous remittent, so I will come to that once we have the correct answer. Can you please show the correct answer, computer ji? Saddleback fever, very important, and this is what should be highlighted in this. You can see this is not a continuous fever because the variation is more than 1 degree centigrade, and you can see it is not intermittent also because the temperature is not touching the baseline. It can see there are no intervals of freedom, so the freedom from fever. So the temperature has to touch baseline in intermittent fever, and in remittent fever, yes, the variation is more than 1. Dr. Ghanshyam is there. Yes, Dr. Ghanshyam, please.
Sir, you're on mute, sir.
So this is characteristically saddleback fever. So
you can
yes.
just give an example of the fevers also, sir. Probably it will help them. Intermittent
So
fever,
continuous fever, you typically, Dr. Ghanshyam is there. Yes, Dr. Ghanshyam, please.
Dr. Ghanshyam, sir, can you hear us, sir?
Yes, so some voice issue is there. So
audio is not coming.
Yeah.
Sir, through headphones, audio is not coming, sir.
Yeah, Dr. Anupam Prakash may continue. I think
so continuous fever, the typical example is you have enteric fever, which is there.
Yeah.
So very few people have got this correct. So this is, I think, for clinicians like us, this is one of the simplest because we have a tendency to check the temperature charts. So all of you should also make it a habit to see temperature charts.
Hello,
continuous
hello.
fever is in Dr. Ghanshyam, yes, right.
Yeah, I'm
Dr.
audible
Ghanshyam
now?
is there. Yes, you are audible.
Okay, sorry. That's very sorry. I'm very, very sorry for this glitch.
Nothing to be sorry about. This is what the technology gives us. Very nice.
Okay. So this was the figure where you can see it's a continuous fever versus remittent fever you have all seen. And this fever was suggestive of a saddle fever, which was most commonly seen in Indian setting like a dengue fever. It's most commonly 2-3 days, but after 2-3 days, there's no fever suddenly subsides. And again, after 3 to 4 days, it comes up. So this was a classical example of a saddle fever, which is seen in dengue. But other than that, it can also seen in tick fever, especially in USA, as well as sometimes in chikungunya fever. So can we have the winner for this quiz question, Computer G? Okay, so winner is Dr. Parnendu Mukherjee, and he belongs to Medical College and Hospital, Calcutta. Congratulations, Dr. Mukherjee. So this he took around 12 seconds to answer this question.
Yeah,
Thank
so
you.
Dr. Ghanshyam, if you just compare the earlier two questions, as Dr. Sudarshan also pointed out, that the question which needed just a recall memory, it took 1 second. But the question which needs some interpretation, which needs real clinical knowledge, especially the type of fever which we tell on the bedside, the students are taking much longer time, more than 12 seconds. So that's what we need to learn, that more of the clinical medicine need to be practiced in day-to-day life. Yes,
Yeah,
Dr. Ghanshyam.
exactly. So we have the correct answer, and we can go to the question number next question.
Question number 4.
Question number 4. The question number 4 is, which of the following is not a major manifestation of a rheumatic fever? Is it myocarditis, A option, B option is arthritis or a polyarthritis, C option is polyarthalgia, and D option is subcutaneous nodule. Your time starts now. Okay, so Computer G, time is over. So you have got an option. It's a rheumatic fever, which is a post-streptococcal infection. You all know. I think it was an easy question. So if you can see, the options were A, myocarditis, C, B, arthritis, polyarthalgia. B and C are look similar. So Computer G will give us the correct answer first. Okay, so answer was C, which is not a major manifestation. Major manifestations are like pancarditis, which is part of a myocarditis, arthritis or a polyarthritis, and subcutaneous nodule. Other than that, there may be other involvement like skin rash, especially edema marginatum can be a presentation, as well as, but there's a 2015, the new Jones criteria is there, in which in endemic region, polyarthalgia is also considered to be a major manifestation. But here, because arthritis and polyarthritis, especially migratory polyarthritis, is a major manifestation. So that is there. So correct answer will be, sorry, here we have to have a not a major manifestation. So correct answer will be polyarthalgia, which is in a way not a correct answer. That means it's not there. And so Computer G, can we have, and other than that, if you have to use a Jones criteria, you have either two major criteria are there, or you can have a one major and two minor criteria to fulfill the infection by a post-streptococcal rheumatic fever. So we have 62% of the students have correctly answered this option, and that's a very good thing. And I think it's a very common thing for a medicine student to know rheumatic fever. And I think we can have the jury also that anything else extra to be added by our expert. I think, yeah.
Nothing. But anyway, the question and answer, are they acceptable in the current scenario of science progress? Is it okay? Should we retain this question as a good question?
Question was a best option. So especially given like arthritis is there. So if arthritis is there, then arthalgia doesn't come there.
So then should we experts, you please decide?
Yeah,
we have disallowed in the pediatrics. In the morning, we have disallowed 1 or 3 questions. We have disallowed on certain criteria. If you disallow it, we will take extra question. You please decide, physicians. I am from community medicine, not internal medicine. Yeah, please.
So we can take our opinion from Dr. Ramesh or
Yeah.
other expert, Dr. Anupam
Yeah.
and all. Should we take polyarthralgia as an answer or not? Although 62% of the students have picked it, majority.
No,
No, but,
polyarthralgia is not this thing, na, major criteria.
Not a major criteria, but there are some modified Jones criteria where some people even polyarthralgia in endemic region. So, but India, because so many patients do have polyarthralgia because of some other reason, like they have a vitamin D deficiency, osteomalacia, and all. So we don't have a robust data to include as a major criteria. But option wise, I feel it's should be taken as a correct. We can take one more opinion if.
Yeah. Shubhalakshmi,
Yes,
yeah,
sir.
please.
Yes, sir,
Yeah.
it can be included because polyarthralgia is not a major criteria as
Okay,
already
okay.
discussed. Yes.
So we retain this question,
Yes, sir.
and the answer at the best, whoever has given the fastest finger first, I think back to Quizmaster. Yeah, yes.
Yeah, Computer G, can we have the correct answer?
Yeah.
Okay, so congratulations, we have a new winner. Nilanjan Mai is the new winner, and the person is from RIMS Ranchi. So this is the East Zone quiz, and we have a person from doctor from Jharkhand also, and he took only 1 second to answer this. So it's so easy, sir. You should not worry about the correctness of the answer.
Question.
Is very easy for him.
Okay.
So without with before reading only, he is already clicked because there's no 0.5 second timer there.
Oh,
1 second it will take.
Okay.
So we can go to another question, Computer G. Okay, so question number 5. A postnatal woman comes to the OPD with complaints of right breast pain on examination. She has right breast was red and congested. Which of the following is a false statement? So you should remember it's a false statement. All three are correct except for one. So option number A is mastitis generally are self-resolving and do not progress to the breast sepsis. B option is treatment of breast sepsis is IND. And C option is in addition to antibiotic therapy, it is important to avoid milk stasis. The patient should be encouraged to continue feeding or hand expressing the milk from the affected breast if possible. The fourth option is this is a case of a mastitis. Your time starts now. It's a negative STEM question. False. So all three are correct except for one option. Thank you, Computer Ji. I think 15 seconds are over. It's a lengthy question. I feel a lot of students must have took some time to answer. And above that, all three options were correct except for one. We can take Computer Ji's answer first. Computer Ji, can we show the correct answer? Okay, so answer was A. Mastitis generally are self-resolving and do not progress to the breast sepsis, which is totally wrong statement because if this mastitis which has occurred because the examination finding suggests it's a swollen red congested breast which is suggestive of mastitis, so there is a mastitis there. And above that, there's development of abscess is very common if you don't express the milk. So this is a problem of a postpartum lady where this may present as a fever and with mastitis, and later on if you don't take care properly, they may lead to a breast sepsis and they may even require a IND or a incision and drainage. So first option was wrong, that it doesn't progress to the breast sepsis, and this is a leading cause of postpartum fever, especially in after delivery. We can have the winner for this question, or okay, so option A was given by 45% of the student, which is very good. So most of the 50%, although this problem is more of a gynecological problem or a obstetric problem, but still I can see the medicine people are have a very awareness about postpartum fever and sepsis also. So we can have the winner name, Computer G. Okay, so winner, we have this fifth question. We still have 15 questions to go on. So winner is Dr. Abir Das. His college is Assam Medical College and Hospital Dibrugarh. So he's also from Dibrugarh. A lot of people are participating from Dibrugarh, Assam. This is very good thing to know. and he took just 4 seconds to answer this. Very good and a very quick response to this question. So Computer G, without wasting time, we can go to the sixth question. This is a slightly tricky question with a picture. Is a Hogland sign is seen in? Is it infectious mononucleosis? Is it mumps infection? Is it rubella infection? Or is it leptospirosis infection? Your time starts now. Computer G, we can have timer. Yeah. Okay, so time is over. There was 4 options for this Hogland sign, although it's slightly tricky question, I will say. Computer G has given. You can see in a picture that there is some eye edema is there, some periorbital edema is there in this patient. So Computer G, can we have the answer? Okay, so this suggests that this is infection by infectious mononucleosis, which is a viral infection, and this usually occur secondary to Epstein-Barr virus infection, and this may be due to this may present as a fever. There may be a rash also. There may be a lymphadenopathy, and some patient may have a joint pain and all. So this is a classical presentation of fever with rash, and this sign is very specific for infectious mononucleosis. We can see that this edema part occurs especially on the upper eyelid, and this can give you a clue. Otherwise, we don't have a good test to do a confirmation of EBV. It's an expensive test, heterophile test, and we can see that 91% of the students have correctly answered. It's a very positive thing that they know a lot of dermatological finding also. And EBV infection confirmation is still, I think, in Indian setting is a difficult problem here. So still, I will say congratulations to all the participation, especially from the east of India. And Computer G, can we have the winner for this question number 6? So winner is Nilanjan Mai, I think, Nilanjan Mal, I think, and is a Jharkhand. So I think I have seen this name second time. So congratulations to him. And he just took 2 seconds to answer this. So he must have seen this EBV infection, and he knows that this rubella and measles seen more of in a pediatric age group. So we can go to the next question, Computer G. So this is another dermatological question. Pastia lines is seen in query rubella, query chikungunya, query scarlet fever, query measles. Your time starts now. Computer Ji, can we have time? Okay, so time is over. You just got 15 seconds to know. And this here you can see some elbow joint has been shown, and there are some lines here. And Computer Ji, can we have first correct answer so that students are relaxed that they have got a correct answer? Computer Ji, can we have the answer? Okay, so this is scarlet fever. And in scarlet fever, we all know this is another post-streptococcal infection. And more important finding will be a body rash. Erythematous rash is seen in this patient. And followed by, there may be a strawberry tongue there in this patient. And there may be sore throat also. And sometimes these patients have a very specific finding of these maculopapular lines over the, wherever these joint lines are there. So it's more of a erythematous rash, which is slightly papular also. And sometimes you can say it's a skin paper type of lining is present here. This may give you a clue that it's a scarlet fever post-streptococcal infection and very specific for this infection. Other than that, you all know chikungunya fever may also present as rash, and rubella fever and measles can have small this small nodules like rash, but not like this pastia line. This is very specific for scarlet fever, post-streptococcal infection. Can we have a percentage of students who have correctly answered this question? I'm audible?
Yes, sir. You are audible. Can we have the graph, please?
Yeah, can we have the graph? Okay, so scarlet fever less commonly seen in Indian setting, but this streptococcal infection are a big problem, especially in pediatric age group. So computer G has taken a difficult question. So correct answer is given by 77% of the student, scarlet fever. Very good to know that a lot of students are easily making the diagnosis even with the Pastia line, which is rare in Indian setting. So the winner of question number 7 is Sumit Das. Is from Darbhanga Medical College. Okay, so we have a new college entry from Bihar, and congratulations to the Dr. Das to join here as a another question winner. So we have plenty of students here. We are answering. I think many more students are joining with questions. Still, we have 13 questions. I think 4 or 5 fastest finger first can give you a first or a second quiz position. So keep trying. You still have 13 more questions. Computer G, can we have the another question? So this is the question number 8. A 40-year-old female developed acute onset of fever, painful rash over arms, legs, and face. You can see this picture also. Skin biopsy showed neutrophilic infiltrate without vasculitis. The total count shows neutrophilia and raised ESR. What is the probable diagnosis? Is it dermatomyositis? Is it SLE? Is it Sweet syndrome? Is it pyoderma gangrenosum? Your time starts now. So any of the expert, if you want to add, please do join us. So Computer Ji, thank you. So time is over. So there's a picture here where you can see some nodular papular lesion, especially it's erythematous also over shoulder as well as slightly over the arm also. So Computer Ji, can we have the correct answer so that students know that they have correctly clicked or not and their computer is working? So it's a Sweet syndrome which is given and which is a correct answer. So Sweet syndrome is like here it's clear cut written skin biopsy suggests a neutrophilic infiltrate. So biopsy has been done. In Sweet syndrome, what we see is it can be a secondary to any autoimmune disease. It can be due to any infection. Its presentation may be a post-infectious. What we see is on examination, you have a subcutaneous swelling or a nodular swelling just subcutaneous to it, which is suggestive of some paniculitis or infection of the inflammation of the dermis, especially fat tissue get inflamed. And when you do a biopsy, this is also called neutrophilic dermatosis. And but you need a biopsy to confirm because it may be secondary to any malignancy also. So sometimes malignancy can cause this, and sometimes infection or sometimes idiopathic. So you do a biopsy to confirm that it's a Sweet syndrome, and very good response to corticosteroid therapy also. So Computer Ji, can we have the graph to see the results of this question number 8? Okay, so we can see 87% of the students have correctly answered Sweet syndrome, which is we have to do a biopsy to confirm the Sweet syndrome, especially paniculitis, and it's very encouraging. I'm very happy to see that A and B option was none of them has given, although SLE can present like this also, and but still 87% is a very high marking and very good response. So Computer Ji, can we have the winner for question number 8? Thank you, Computer Ji. So we have a Nilanjan Mal. He's leading answer. I think he's already answered 3 or 4 fastest finger first, and he's answering within 2 seconds. So Jharkhand RIMS College is coming very good in this East Zone quiz, and best wishes to him as well as other participants should buck up. And it's still 12 questions to go. We can have next question, Computer Ji. Okay, so question number 9 is all of the following are causes of urticarial rash, which is hives with fever. So it's a fever quiz, and but question is a negative stem except, so all answers are correct except one of the options. So option A is lymphoma, Option B is hypersensitivity reaction to an allergen. C is serum sickness, and D is systemic lupus erythematosus or SLE. Your time starts now. Okay, so time is over. Thank you, Computer Ji. So question was slightly tricky. Again, accept question is there. So they have given an option that patient has developed a urticarial rash, but most of these rashes will associated with fever except for one of them. So Computer Ji will let us know which is the disease in which you don't have fever. Just rash is there, urticarial rash. Okay, so answer is B, hypersensitive reaction to an allergen. So this option is correct. So in this, what happens that urticaria rash, the rash which is very itchy rash, and erythematous rash which occurs, especially any drug rash or allergy which will be cause a hypersensitive reaction and all. So these rash last for maybe 1 to 2 days, but usually they disappear within 2 days. So if this rash is associated with fever, you should always think about any systemic disease like a lymphoma. So you should rule out lymphoma or a reticuloendothelial malignancy. SLE rash, maybe urticarial rash may present as of a SLE also, but they will be associated with systemic symptoms like fever, weight loss. There may be other symptoms of other joint pain and even malar rash over the face and all, just not urticarial rash. Other than that, serum sickness is also a systemic illness where you will have fever. So answer to the question number 9, we'll see graph wise how many students have correctly answered. And the first option has given by 50%. So here only 6% of the students have correctly answered, which is the answer was difficult for them. A lot of dermatological questions are there. So articular rash due to allergen. So I feel let's see who is the uh, genius person who has correctly answered. And this is the very few question where very few students are able to correctly answer. So okay, so it's Dr. Mayank Sodhani, and he is from Rajendra Institute of Medical Sciences, Jharkhand. So it's a RIMS only. So I feel Dibrugarh, RIMS, Jharkhand, some people from students from Bihar are there who are winning. I hope Calcutta people and West Bengal people also come up with good answers, and they will be leading in next few questions. Still, we have 11 questions. You can still be a winner. And we are here not only one winner, we will take two winners from here for the final in Bangalore. And he took just 2 seconds to answer. Congratulations to Dr. Mayank. We can go to the next question. Okay, so it's a question number 10. A 35-year-old male present with fever of temperature 39 degrees centigrade. It was associated with chills and a productive cough. He is having productive cough with rusty sputum. He also has a pleuritic chest pain. What is the most likely diagnosis? Is it viral bronchitis? Is it bacterial pneumonia? Is it tuberculosis? And is it acute bronchitis? Your time starts now. Okay, so time is over. So this was a question which suggests there's a 35-year-old male, and he present with fever and high grade fever, 39 degree, and chills and rigors. And one of the thing which can give you a clue that it is a productive cough with rusty sputum. So rusty sputum may be a slightly dark colored, maybe a brown colored. So let's see what is the answer by computer G. We can have the answer first. Okay, it's a bacterial pneumonia. So as the history suggests, patient has high grade fever and as a productive cough, which suggests it's most likely bacterial. And because he's having the systemic symptoms, and if you see other option, tuberculosis, and which is a less possibility because they present more often maybe a hemoptysis and a chronic fever, not very high grade fever, especially not a very common thing. Other than that, acute bronchitis won't have a productive cough, which is rusty, and viral bronchitis also will be having just cough and a lot of viral prodrome, like COVID and all. But sputum, which is rusty, is almost similar to like some a lot of purulent material is there, which give you a clue of a rusty sputum. So answer option was rusty sputum. Option was B. So we have 100% of the students. So it was an easy question. I thought some people will think that tuberculosis, especially like miliary tuberculosis and all, can present like high grade fever. But this was classical presentation of this bacterial pneumonia. This was the easy question, but the winner will be only one for this question, and winner will be decided by fastest finger first. So let's see who clicks the answer fastest with the B option. Computer G, can we have the answer sheet? Okay, so Nilanjan Mal again, I think he is going to be on the podium today. Congratulations to Dr. Nilanjan, and he's doing very good in this quiz. And best of luck to Nilanjan and his team of RIMS. Other colleagues are also there. So we're still waiting for see someone from West Bengal or a Calcutta. Last time there were a lot of students were from Calcutta also, and even Cuttack, and I was hoping some Odisha students will be there on the podium also today. Kamputerji, can we have the another question?
Yeah, sir, do you want to see what has happened after 50%, sir? That the scoring has been sent by the scorer.
Yeah, we can show it to other judges also.
Okay, so there are many. Abir Das, one correct answer. Himamshu Chauhan, 1. Mayank Sodani, 1. Nilanjan Mal, 5 correct answer. And Purendu Mukherjee, 1. And Sumit Das, 1. So 10, and this is the score as of now. Yeah.
Okay, I will request any of the expert wanted to say anything.
Yeah, Dr. Ghanshyam, this is T20. Things can turn around in the second round.
Hello, can you hear me?
Yeah,
we can hear.
Dr. Ghanshyam, am I audible?
Hello.
Yeah, he is not able to hear.
Yeah, problem
Hello,
is
can
at
you
its
hear
end.
Sir, can you hear us, sir? Dr. Ghanshyam, sir, can you hear us? I think.
Yeah, you hear me, ma'am?
Now we can hear you. You can, yeah. Okay. Right. Can we continue?
Okay. So I was just trying to see my earphone is working or not. Okay. So can we have Nilanjan Mal is just winning by a big margin, I think. But still we have half of the quiz still with it. So we can have a question number 11. 40-year-old woman presents with fever, dysuria, flank pain. Her urine culture is positive for E. coli. What is the most likely diagnosis? Is it cystitis? Is it urethritis? B option. C option is prostatitis, or D option is pyelonephritis. Your time starts now. And I will request our experts also to give some comments on this slightly tricky question. Thank you. Your time is over, and I think it was again a very easy question, and most have student, maybe 100% may have correctly answered. We can have the correct answer, then we can have some expert comments from our judges who are experts. Okay, pyelonephritis is the correct answer. Any comments from our experts, sir?
Yeah,
Dr.
Dr. Ghanshyam, I think choice C can be safely ruled out in this patient. So,
Good job.
So we have only 3 choices to find the correct answer, and patient has a problem and the pain in the flanks, which are pointing towards upper UTI rather than a lower UTI, and of course, patient is symptomatic. And amongst the available choices, pyelonephritis, students must have marked it correctly. Let us see who has marked it fastest rather than only correct. Let us see, Dr. Ghanshyam. I think Dr. Ghanshyam, again, the problem is that
you see headphones, I think. Can we have the graph, please? Yeah. I think he is having problem with your headphone. Sir, can
you hear me, ma'am?
We can hear you, sir. Can you hear us, sir?
Yeah, now I can hear you. I was just charging my this earphone. Okay, so 100% of the students have correctly answered. As Dr. Sudarshan said, computer was just playing the trick that female patient and prostatitis was one of the options. So I was just thinking that someone's computer is not working, like my computer is hanging again and again, creating a lot of problem. So thankfully, 100% of the students. But here again, we have finger fastest first as a winner. Can we have the winner, Computer G? Okay, Sumit Das again. He's again comes to the podium. Sumit Das, and he just took 4 seconds to know that it's a pyelonephritis with flank pain, systemic features, and E. coli positive. So, congratulations to Dr. Sumit. And he's from Bihar. Still, we are waiting someone from Odisha or someone from West Bengal to enter the podium. We can have another question, Computer G. Okay, this is question number 12. A 40-year-old male presented with gradual difficulty in climbing stairs, low-grade fever, and skin rash over the face, hands for past 6 months. You can see this picture of hands as well as his face. Oh, what is the probable diagnosis? Is it SLE? Is it post-Kala-Azar dermal leishmaniasis? Is it dermatomyositis? Is it Sézary syndrome? Your time starts now. Okay, so time is over. It's a slightly lengthy stem, but you can see some rash over this eyes is there. You must have noticed some of the this red maculopapular lesion. A lot of dermatology is there. Computer G is, I think, more than 50% question are from some dermatological clue is there. Although fever with rash is difficult as well as very common in our presentation in OPD as well as emergency. So you should be aware, and this can give you a spotter. So if you see this type of patient, you have seen in a book, if you see in your clinic and your OPD, you can easily make a diagnosis. You don't need biopsy and all, although for treatment you may need a biopsy and other confirmation. But this can be a spotter, a simple spotter. You can make a diagnosis. So Computer G has already given answer. It's a dermatomyositis, which may present as a proximal muscle weakness. So the history suggests it comes with a gradual difficulty in climbing stairs, which suggests it's a proximal muscle myopathy or proximal muscle weakness. There's a low-grade fever, so infection is unlikely, and followed by a skin rash. And that skin rash was more of a suggestive of heliotrope rash, and Gauthron's papules was there. So answer C is a, I'm thinking answer C was the correct answer, dermatomyositis, and very good to see only few students were unable to pick it up. They may have picked up other option like SLE and all, but still 92% is a very good option. But this quiz is who is the fastest person, like the Olympics are going to come in very few minutes. Who clicks the correct answer will be the quiz winner. And it's we have a new winner. It's a Ipsha Bhushan now is come. This is again from RIMS Jharkhand. Congratulations to Dr. Ipsha, and she has taken just 2 seconds to answer it. Just 2 seconds. Very good. So diagnosing a heliotrope rash over face and Gauthron's papules over the hands and knuckles with a picture, and just taking 2 minutes, 2 seconds is really a commendable job. Congratulations, Dr. Ipsha. We can go to another question, question number 13. This is question number 13. A 35-year-old man presents with a high fever, severe sore throat, and difficulty in swallowing. Physical examination revealed swelling and redness over the tonsils with purulent exudate. What is the most likely diagnosis? Is it acute tonsillitis, acute laryngitis, acute sinusitis, and acute bronchitis? Your time starts now. So you have 15 seconds to answer, and most of the students have already clicked the answer. Thank you, Computer G. So time is over. This question suggests that there's a 35-year-old middle-aged man, very high-grade fever, severe sore throat, and difficulty in swallowing. And physical examination is clear-cut, given a clue that there's a tonsil which is red, swollen, and even purulent exudates are there in the tonsils. So let's see, Computer G is giving an answer, clear-cut answer. Let's see, Computer G. So answer A is the correct answer, acute tonsillitis, which is clear cut given in the question stem only. So other option like laryngitis and all will not have purulent exudates over the tonsils. They will have more of a hoarseness of voice and difficulty in speaking. Acute sinusitis may present as a nasal secretion more often, and a headache or maybe a sinusoidal tenderness may be there. And acute bronchitis may have just dyspnea and maybe a cough or a dry cough, but not purulent exudate. We can have any comments from Doctor, any of the expert. Although this was one of the easy question, I feel, and I'm very sure that more than 90% or 100% student have easily answered.
100%.
Yeah, yeah, because
Yeah, Dr. Ramesh can add something.
yeah, tonsillitis is not very common. We do not see it. Although we are physicians, we generally just restrict ourselves to pharyngitis and these things. But yes, persons who have seen and probably our postgraduates are
Yeah.
very much well versed with this topic. 100% are correct, Dr. Ghanshyam.
Yeah, so 100% are correct, and we should now. Good thing is that we have a torch in the form of our mobile phone, so we
Yes.
should always say whenever there's a uh, especially difficulty in swallowing and all, you should see tonsils. Is easy to see, easy to treat,
And
and that will
rather,
save a lot of time.
more the Dr. Ghanshyam, more than tonsil, just they can just see the pupils also.
Yeah, that light
Yeah.
is there. Good, good. Thank
Yeah.
you. Yeah. So clinical examination is must. Thank you, Dr. Ramesh. And this is a 13th question. And winner is Mayank Sodhani, and the person is from Jharkhand. Congratulations. I think RIMS people are doing very good. I think Jharkhand RIMS. This is near. I think AIMS is also there. It's near Raipur, I think. Not sure. Let's see. Later on, we can see which college is there. We can go to the next question without wasting time because it's a 14 number question. And we have which of the following statement is true for trench fever? So trench fever not very common in India, but MCQ question is there. Which is the true statement? Also called 6-day fever because characteristic relapsing fever occurs every 6 day. Is it B option, also called Quintan fever, or a Sinbone fever, or a Tibialgic fever? Tibialgic fever. C is also known as Monday morning fever, and D is also called child bed fever. Your time starts now. It's a trench fever. Thank you, Computer G. So time is over. Slightly less common trench fever. It's part of a rickettsial disease, which is occurs mainly more commonly seen first time in World War when a lot of trenches was digged in World War II near that France and German border. So this is, I think, Dr. Sudarshan will also will like to add a lot of history is there because he may be knowing the World War II stories. So first we'll see the correct answer, Computer G, then we can have expert's opinion. Okay, so correct answer, this is a true statement, is also called Quintan fever, Sinbone fever, or Tibialgic fever. And any of the expert, Dr. Sudarshan, want to add something, sir? Trench fever history.
Sir,
Sorry,
you're
sir.
on mute, sir.
Yeah. So sorry, I was on another call, non-call. So anyway, seeing the answers and all, so I have nothing more to add. Thank you very much. Thank you.
Thank you. So this fever is now known to caused by rickettsial mainly Bartonella quintana. So Quintan fever is given there, so it's a clear-cut clue there. You can easily find, and there's a classical finding of tibial pain or a shin pain, which may give you a clue that this is tibialgic fever or a Quintan fever. So 14 question number and B option was the correct answer. Majority of 60% of the student has correctly answered this difficult trench fever, but there was a clue, clear cut Quintan fever. Although this fever is a relapsing remittent fever which occurs, and other than that, the other option was clear cut childbed fever, which is a puerperal sepsis
patient, postpartum sepsis patient, which doesn't fit into this thing. And the other one was a Monday fever, which occurs more of a functional or a psychotic fever. People don't want to go to office and all. They say we are having fever and we will take rest, which is very common nowadays. So correct answer was B option, and we can have the winner for this question number 14, Computer G. Okay, so Nilanjan has come to the podium for the sixth time this quiz. Out of 14, six correct answer. This is too good to think about. I hope he is using all fair means and not taking a lot of help from his colleagues and all. But next time in the final, we will have a live telecast of your this all screen will be there. So be ready for final also. So we can have. He took just 4 seconds to answer. Congratulations, Dr. Nilanjan. So question number 15. What is your probable diagnosis? There's a picture of a person on the right side. Is it herpes? Is it disseminated fungal infection? Is it scrub typhus or is it a spider bite? Your time starts now. I think we can have some clues from experts here. So still have 6 seconds. Okay, thank you, Computer Ji. So your 15 seconds are over. This is question number 15, double 15. So this picture is showing some lesion here, which is over the neck, and you can see some raised lesions surrounding, and there's a necrotic bed also. So, Computer Ji, can we have the correct answer first? It's a scrub typhus. So scrub typhus is nowadays a lot of fever causes are due to this scrub typhus, which is due to a mite bite or a insect bite is there. So this may occur in these places like neck. Otherwise, even these mites can pass on through the clothes and can bite near the axilla and all. And there's a classical eschar formation there. If you find this in a with a fever who is having maybe symptoms of encephalitis or altered sensorium, and they
Yeah,
may have
so yeah,
sinus.
the Dr. Ghanshyam, what is important here for the students is, as you said, that we have to find it out. So a good examination by exposing the patient, because this scar can is generally hidden under your clothes, and it may be found in the axillas and the groins, and we have to particularly look for these SCHARs in those hidden areas. So full exposure of the patient should be done for proper examination, especially in patients who are presented to you with undifferentiated fever and you are not able to make a diagnosis. Yes.
Yeah, very correctly said. And these patients may come with encephalitis, altered sensorium, so they will may require intubation and ICU care. So exposing the clothes, seeing for these scars or the lesion will be an important clue to making a diagnosis. Scrub typhus, anthrax, and all. Even history of going outside, like someone has visited and going in farm, working in farm, they are the more common patient who will have a scrub typhus. And we have Dr. Mukherjee again on the podium this time, and he's from Bengal, West Bengal. We have a person from Calcutta. Good, congratulations, Dr. Mukherjee. And he just took 4 seconds. And we know that a lot of these scrub typhus patients are coming from east of India, especially Jharkhand, Odisha, and even endemic in some North Indian region, especially even in Himachal and all. So we should be aware about this diagnosis, and we should try to treat them whenever there's when we see these skin lesions, especially scars are there. Thank you. So we have reached the 16th question, and this is regarding SIRS, or a systemic inflammatory response syndrome. Which statement is correct? So all four out of four, three statements are correct. One is incorrect. You have to find out. A option, temperature higher than 38 degrees centigrade or less than 36 degrees centigrade. B is heart rate higher than 90 beats per minute. C is respiratory rate greater than 32 per minute. And D option is white blood cell count greater than 12,000 per ml or 4,000 less than 4,000 per ml. Your time starts now.
Thank you, Computer Ji. So this question was regarding systemic inflammatory response syndrome, and this response is usually due to, most commonly due to infection, which may cause this SIRS. Other than that, it may also due to any trauma or any severe stress or inflammation can cause SIRS, which is commonly seen in our ICU and all. So we do have these charts to see that, tick that out of these four options, which two options are suggestive of SIRS. So one option was wrong, and can we have the computer wrong answer out of these four options? So respiratory rate was given as 32 per minute. This was just given as a dummy thing. The respiratory rate is higher on these patients, but it was more than 20 only. So even respiratory rate of 22 and all will fit into a SIRS. You don't have to reach up to 32 minute, or patient deteriorates up to 32 beats respiratory rate per minute, because after 32 rate, person who is having more than 32 respiratory rate per minute are more likely to get mechanical support and all this requirement. So other options were totally correct except for this 32 per minute. And you can see their tachycardia here, they have taken 90 beats per minute, not 100. So more than 90 is taken as a SIRS conformity criteria. And you just need out of 4 2 criteria. Any of our expert want to add anything? So if we can see here, 60% of the 70% of the students have correctly answered, and that respiratory rate was even 20 is good enough to make a diagnosis of SIRS. You don't
Yeah,
have to
Dr.
get
Gansham, that difference between SIRS and sepsis, if it well be known to the students, as you said that when it can be also because of the infection, but when the infection is associated with the bacteremia, and then we call it as sepsis, and when it comes with shock, we label it as septic shock. So of course, these are the old definitions, but they still hold true when we see the patients and decide about the management.
Yeah, it's very important for infectious disease, and which causing sepsis and septic shock. So let's see. Thank you, Dr. Ramesh. And we can have the winner of this question number 16. Computer G, please help us. Okay, so question number 16, Mayank has again correctly answered this question, and correctly, not only correctly, he's answered fastest of all the participants. It just took 4 seconds. So he is must be already done his ICU posting, and he's already seeing a lot of SIRS and making a diagnosis of sepsis and septic shock also. So Computer Ji, thank you. We can go to the question number 17. What is the organism shown in the picture? This picture is shown here of some parasite. Is it Ascaris lumbricoides? Is it Cystosomia hematobium? Is it Taenia solium? Is it Loa loa? Your time starts now. Okay, thank you, Computer Ji. So time is over. It's a picture of a worm or a parasite here, and you can see Ascaris. You must have seen a lot of Ascaris. You have seen a lot of Taenia. So I feel B or D will be your option, even if you have not seen this parasite in your any of the lab. Computer Ji, can we have the correct answer? Okay, so it's a Cystosoma hematobium, which is one of the, we say it's a bladder flu parasite, which infects bladder and causes bladder cancer. So it's one of the treatable cause of bladder cancer. It may present as a hematuria. Thankfully, it's not very common in Indian subcontinent. More commonly seen in people of this Middle East and Africa, where still a lot of people are using wells to take the water, especially in desert area and all. So this is important cause of bladder cancer, but thankfully less common in Indian setting. And the option, I think C was correct answer. I'm forgetting. Can you help us? I think C was cystosomia.
No,
Computer.
B was
B
B
was
was.
Oh,
B,
sorry,
sir.
B was okay. I am also confused. The B answer B was, and because the number of participants correctly answered were low, so I was expecting that they may have seen this in their pathology lab. They may show you this hematocystosomiasis. Other than that, liver fluke is also there, which causes common cause of Middle East this liver disease. So Mayank has again correctly answered. So I think two leading students are Mayank and Dr. Mal is there. Congratulations, Dr. Mayank. He just took 4 seconds to answer this, identify this worm, which is rare in Indian setting. So thank you, Computer Ji, and thank you, Dr. Mayank. So we have reached the 18th question. What is the WHO recommended management of uncomplicated malaria in a pregnant woman in first trimester? We are asking about first trimester medication. Is it quinine with clindamycin? Is it mefloquine, azithromycin? Is it chloroquine only, or is it artemether lumefantrine? Your time starts now, and I feel experts can add some points. Thank you, Computer Ji. So this is a WHO recommendation management uncomplicated malaria in a pregnant woman. So we should take a medication which is safer in pregnancy, especially first trimester, because a lot of medications are not should be avoided in first trimester. And let's see, Computer Ji, which is the correct answer. So the answer given by Computer Ji is artemether lumefantrine. So recently there has been update by WHO that even in first trimester you can use artemether, which was contraindicated till 2-3 years back. So even in complicated malaria you can use artemether as a medication. So this was a new thing, and WHO has cleared that artemether is safe in first trimester. This is 2022 update of this malaria guideline, where artemether can be used. Any of the comments from our jury or expert on malaria, especially first trimester?
Yes, actually, it is very important to note, sir, because these type of patient usually present to us, not only in gynae but in medicine. So residents should be aware of this condition. And as you rightly said, because this WHO has revised its criteria of treatment, and this new drug or this drug which was not indicated earlier is now indicated in pregnancy. Other drugs are slightly like quinine and all. These were used, but because of hypoglycemia, it is not very much used.
Nobody has answered it correctly, sir, in this.
Yeah, because still recently quinine was used, but a lot of side effects are there. So this was a difficult question, 18th question, and Lumifant, this thing, artemether has come up as a big way. Thank you. Next, we can go to the next question. Common disease in Middle East and Africa, again one African illness is again here, and South America with skin eruptions and blindness. Is it leishmaniasis? There's a picture there in the right side. Is it onchocerciasis? Is it sarcoidosis, or it is leprosy? Your time starts now. There's some this. Computer, we can start the timer. So there's some eye disease and there's skin lesion. Thank you, Computer Ji. So you can see the options: leishmaniasis, sarcoidosis, leprosy. All these are very common in India. You must have seen, and I feel onchocerciasis is less commonly seen in Indian setting. Let's see, Computer Ji, what he says. I will suggest this is another difficult question. Computer Ji will let us know which is the most appropriate. Okay, so odd man's out. Sometimes you have to use this thing, especially in a quiz where fastest finger first is the correct answer and will be the winner. So in onchocerciasis, also called river blindness, which is very common in Middle East, it can cause infection of the eye, which may lead to a blindness. And there's nodular lesion over the limbs and subcutaneous tissue, where you can even by cutting or putting a needle, you can remove the worms also. But 100% of the students are correctly answered, because they all know leishmaniasis, leprosy, as well as sarcoidosis. So, and we have given a STEM just option that it is a Middle East disease, not very common in India. So, Computer G, we can have a winner. 100% students were correctly answered. All are winners, but we will have the person who has correctly answered fastest. So, it's a Himanshu Chauhan, and is from Bihar College, DMCH, Bihar. Okay, good. Congratulations, Dr. Himanshu, for winning this question number 19. So, we have reached the final question, and this is the last chance to be on the podium and bringing your name to the screen for East Zone. Okay, Computer G, we can have the 20th question. Okay, Computer Ji. So, question number 20, a 35-year-old female patient was diagnosed to have a pot spine and was started on anti-tubercular treatment. She had no motor weakness and sensory involvement. On examination, her knee and ankle jerks were exaggerated. What is the stage of the pot spine paraplegia in the patient? Is it stage 4, stage 3, stage 1, or stage 2? Your time starts now. Thank you. So, Computer Ji, time is over, and this was the last question. And let's see how Computer Ji analyzes this thing. Although TB is very common, pot spine is infection of the tuberculosis of the spine, but we rarely use this type of staging. And the answer is stage 1 of pot spine, which is early stage. You can see that in the stem they have classically written she had no motor weakness. So weakness is not there. So stage 1 of this is more commonly used by orthopedician or a patient being treated by a neurosurgeon, where they want to operate or not operate. That decision has to be taken, although anti-tubercular treatment has to be given in all these patients. So in stage 1, it's a negligible disease. They are able to walk and all. They don't have any of the weakness. While stage 2 will be patient who needs some assistance. While stage 3 is stage of spastic paraplegia. While stage 4 is the late stage and very severe disease, where it is flaccid paralysis is there. So stage 4 has a very, very poor prognosis compared to stage 1. So luckily this young female has been diagnosed early, and hopefully she will recover of her pot paraplegia. So Computer Ji, can we have the graph to show how many of students are correctly? I think very good number of students will be able to answer tuberculosis. So tuberculosis is very common in Indian setting. ATT is a lot of patients are on anti-tubercular treatment because of even PU or of pyrexia of unknown origin. And you can see answer C is D is given. A lot of patients students are given, but there was a slight uh, no weakness was written specially. So option C or stage 1 will be the correct answer. So let's see how many students have correctly answered stage 1 of the disease of pot spine. I think this classification is also called Thule classification. And Dr. Mayank has again come up with the correct answer. Congratulations to Dr. Mayank. He's from RIMS, Jharkhand. And we missed a lot of state in this quiz, especially Odisha people. I was thinking of some of the Odisha or Jagannath Bhagwan ji ke students will be there, but we missed it. Doesn't matter. So we have concluded 20 questions, and we have to, our Fever Foundation has to select two winners, winner 1 and winner 2, and both will be participating in the final quiz in Fever annual conference. And if there's a tie break on position 1 or a 2, there will be another 3 question for those tie break students. So let's see what is the results, and
till Computer G makes the result, we can have some expert opinion from our juries as well as our quiz host. Dr. Anupam has joined and Dr. Manjula is there. Sorry for the glitches in the early stages. I am not sure what happened initially in the initial 5 to 10 minutes. Let's wait.
Technology has its own way of teaching us. So these glitches were good because those bumps made way for a smooth ride. So hats off to Dr. Ghanshyam. So it is wonderful being there. And Dr. Ghanshyam, obviously, when you start an innings, he was the opening batsman. So the ball and the pitch, everything is new. And there are a couple of bouncers. Some balls go outswing, some are leg breaks, all those things. So that is what happened to Dr. Ghanshyam. But that is okay. All is well that ends well. And we have completed the first round very nicely. So back to Dr. Ghanshyam. The result of East Zone is ready, I think.
Computer Ji, if results are ready, or should we?
Yeah, I think it is ready, so they are putting it on.
Okay, so congratulations to all the participants. I think everyone has given very quick answer, except for one question which nobody was able to answer, and rest of the question I think majority of students were able to answer. And Computer G has specially designed this question for a lot of pictures so that you cannot pick the answer from Google and all. And a lot of questions were difficult. I will say dermatology questions are there. Difficult question. I will say out of 20 questions, 12 to 13 questions were really difficult to make it out, and you cannot get help until unless you have seen those patients. So clinical examination, seeing those patient experience will help you in making a diagnosis. And a lot of this question where these spotters are there, so if you see those patients even in your books or even in your practice, it will really help you in making a diagnosis. So heads up to all of you for participation, and best wishes to two person who will be selected for East Zone. And I think is a big prize which will be announced by Dr. Manjula. Very big cash prize as well as a big certificate, and you will get a good memento also at your college only. So you will be famous in your college that you won East Zone, and you will be participating in the Fever fifth one in November 2024. Dr. Manjula can add.
Yes.
What is the
Any
big
guesses, sir?
prize?
Any guesses, sir? Tie hoga, nahi hoga? Do we have to have tie?
I'm not sure, sir, ma'am. Other juries can tell us, but I'm not sure. I was not counting the
Dr.
answer.
Sudarshan wants to say something. I don't think there is going to be a tie easily.
No, I do not want to say anything, but the questions were very good. I think I will congratulate whoever has contributed to this question bank.
Dr. Ghanshyam, sir.
Okay,
Dr.
good.
Ghanshyam needs to be congratulated till 3 p.m., 3:30 p.m. He was on the job. And
Yes,
Dr.
sir.
Manjula actually messaged Dr. Ghanshyam to be ready in half an hour. So,
Correct, sir.
No. This is all Fever question bank, which is collecting the questions. And we have just seen
it is
that
kind
there's
of
not.
Dr. Ghanshyam to say so.
I
No,
know.
no, no.
Correct.
We are very thankful to Fever team. They have helped us enormously to making this quiz, specifically set A, B, C. Let's hope it will be not a tie break, so that we can have a smooth result, first and second, and there's less of a trauma to our participants. Computer ji, can we have the result?
It's still compiling.
Yeah, compiling.
Oh,
Yeah.
they have results.
Good.
Sir, correct.
Oh,
No tie
okay.
break.
So
No
there's
tie
a no tie break, and we have a clear-cut winner. Not
Yeah.
a clear-cut winner, very close results, I will say.
Yeah, correct,
So,
sir.
so I think Dr. Mayank has very rapidly kept the pace, and he's his second place. And the winner of our today's quiz is Dr. Nilanjan Mal, and he got six correct answer. And I think after that he took some rest because his six answers were already during 13th or 14th question. And then Dr. Mayank has taken up and fifth. Congratulations to Dr. Nilanjan and Mayank for winning the East Zone quiz. And rest of the participants, I think they have participated very well. Dr. Himanshu, Dr. Mukherjee, Dr. Sumit, Dr. Abir, Dr. Ipsa, all are needs a big accolades for reaching the podium, and they have answered 2221. Congratulations to all the participants. And Dr. Nilanjan and Mayank, we can have some lighting also. We can have some animation for them. Okay. So Dr. Nilanjan is from RIMS Ranchi, Jharkhand. Congratulations. And another person is also from the Jharkhand. So Dr. Mayank also, both are from Rajendra Institute. And congratulations to the Jharkhand team. RIMS has done very, very well. And you both are invited for the Fever FIPCon. And Dr. Manjula will invite you and also announce the big prize money also. Over to Dr. Manjula, ma'am.
Yeah, thank you, sir. It was really wonderful. Anybody would like to speak before we close, sir?
Dr. Sudarshan sir will like to have, we would like to hear from him. Yes, sir.
Yeah. See, I was there in the pediatrics in the afternoon, and now I am there in the medicine PG quiz. I am very happy that the questions were really prepared with some serious effort, quite painstaking, and it is a good learning experience for the postgraduates who participated, and it was run very smoothly, and I think we have spent about 2 hours, and it was a good learning experience for me also. I congratulate the medicine team and Fever Foundation for this quiz program. Over to Dr. Manjula, please.
Thank you very much, sir. Just before students leave, I want to tell them the poster competition is being organized for the FEFCON 2024. The last date for submitting your poster is September 10th, and the poster that what you submit has to be fever related, and there will be poster competition which happens in the October. So kindly share, the details will be sent to you as well as to your college. Please submit the poster for the competition. So thank you so much. I thank Quiz Master Dr. Gansham sir and quiz host Dr. Anupam sir, our expert Dr. Ramesh Agarwal sir and Subbalakshmi madam, and our jury Dr. Sudarshan sir for helping us in conducting this quiz. And thank you so much. And it was really wonderful. And it was not only play, and lot of learning happened for the student who came. So really it was both fun and learning experience. Thank you so much. I thank Microlab's marketing team headed by Mr. Praveen Singh and digital team Deepika and RX event for a smooth conduction of this meeting. So thank you all. Thank you, sir. Namaste.
Thank you.
Thank you.
Good night.
you.
Good night.
Thank you. All the best and congrats, everybody.
Thank you.
Thank you. Congratulations, Nilanjan, and congratulations, Mayank, again.
And
See you in the annual conference.
congratulations to the winners. Our Fever Foundation team will contact you and they'll help you out in further. And also, I would like to say all the participants would receive participant certificate of the quiz.
Yeah, even who has not reached the podium will receive the
Yes,
certificate.
participation
Thanks to Dr. Manjula.
certificate. Yes.
Participation certificate.
Yes.
Thank you, ma'am.
Thank you.
Thank you. Thank you,
Thanks,
everyone.
thanks.
Thanks
Thank
to
you
the,
all.
all the
Thank you all.
juries.
Thank
Thank
you
to
so
the all
much.
judges.
Thank
Thank
you.
you. Thank you.
Thank you.
Hello, sir, madam. I think it went off smooth, na, ma'am?
Praveen, now you are there, so I am logging back in. Yes, hello.
Initial